Good morning, neurodivergent nation. This video is all about applied behavioral analysis therapy, or ABA for short. But first, let me talk with you about conversion therapy. Don't worry, we'll get the connection between the two. Conversion therapy is a dangerous, harmful practice of using psychological, physical, and spiritual manipulation to force someone to change their sexual orientation from homosexual or bisexual, or really anything other than heterosexual, to heterosexual. Clinicians have used techniques in the past, such as shock treatment to the genitals, ice pick lobotomies, chemical castration, spankings, intentional ignorings, administering nausea-inducing drugs, and more in their attempt to stop homosexual behaviors. But most recently and more commonly, they've used specific types of counseling, visualization, social skills manipulation, psychoanalysis, prayer, and group pressure on their clients, in my opinion, in a negative way. This was a practice that, in my opinion, started out bad and never had a redeeming quality to it. It is and always was rotten to the core. Today, there's no professional legitimate association that supports it. In fact, the American Psychological Association condemns the use of conversion therapy, citing that it's unethical, ineffective, and has potential to harm. States and countries around the world have passed laws making it illegal to use. Additionally, I challenge anyone to show me one piece of evidence that suggests that a person's sexual orientation can actually be changed. Can you believe that there are still some clinics today that still use conversion therapy? I mean, honestly, why would anyone, especially a medical or mental health professional, put someone through conversion therapy? Was it because in the past, many of the decision makers in the medical and psychological community were ignorant or intolerant or influenced by political or religious organizations? You see, anything other than heterosexuality was once considered a mental disorder and was even called a disturbance, deviant, sinful, criminal by many influential professionals. So, who was the guy who created this highly controversial intervention called conversion therapy? There were several who took part in its creation, but one of the guys who stands out, who's responsible for it, his name was Avoidance. He co-authored research using reward and punishment to try to change the feminine behavior of boys so that they wouldn't grow up to act homosexual. That was his idea anyway. Tragically, the first boy they performed this conversion therapy on at the age of 4 later died by suicide just 11 years ago. And it's been since shown that there's a correlation between those who receive conversion therapy and those who die by suicide. Now, you might be saying, but Dr. Service, this video isn't supposed to be about conversion therapy. It's supposed to be about applied behavioral analysis. You're right. Let me read you a quote. You see, you start pretty much from scratch when you work with an autistic child. You have a person in the physical sense. They have hair, a nose, and a mouth, but they're not people in the psychological sense. One way to look at the job of helping autistic kids is to see it as a matter of constructing a person. You have the raw materials, but you have to build the person. Okay, I did that in a different voice so that you wouldn't mistake me as having said that. Well, guess who it was that said that? That was Avoidance who said that. The same guy who, along with another scientist, drew up the guidelines and published the initial studies that duped the world into thinking conversion therapy was a good idea. Around the same time, he was putting innocent people from the LGBTQ community through conversion therapy. He was also in the process of designing a new revolutionary form of therapy for autistic children called applied behavioral analysis, or ABA for short. Yes, the man who created conversion therapy to change behavior in perfectly fine LGBTQ people in the community is the man who created ABA, apparently to change behavior of autistic individuals, using the same principles and the same techniques. The difference now is that conversion therapy has or is being outlawed worldwide, while ABA is still widely used throughout the world and is gaining momentum and is still being applauded by professionals and organizations that just love their little puzzle piece around the world, and they think it's effective in changing the behavior of autistic children. When the initial trials of ABA were concluded, Avoidance gave an interview of his success, and he said, throughout, there was an emphasis on making the child look as normal as possible, rewarding him for normal behavior and punishing his psychotic behavior, teaching him to please his parents and us, to be grateful for what we would do for him, to be afraid of us when we were angry and pleased when we were happy. Adults were in control. So when Avoidance was training clinicians to administer ABA therapy, he taught them to yell at them, to slap them, and even use electric shock therapy to try to stop them from stimming, which he called, and I quote, garbage behavior. So while we're talking about shock, it might shock you to learn that electric shock treatments were still being used on autistic children until March of 2020. What? What year is this right now? Right now it's March of 2021. So that was last freaking year. These interventions may be extreme versions of ABA treatment, but by the standards of much of the pro-ABA professional community, they can still be used today. Everything except for the electric shock. In fact, some research says that ABA therapists with increased training are able to use tactics such as verbal disapproval, ignoring the child on purpose, not allowing toys or comfort items or food, slapping them, spanking them, and using restraints. All of these strategies I wouldn't want anyone to use on my own child or me, and these are all called aversives. That's what they're called, aversives. Now, not every ABA therapist is on board with using aversives. Those ABA therapists who do not like to use aversives instead use something called positive reinforcements. This means when a child does do something that they want the child to do, such as making uncomfortable eye contact, agreeing to a hug from somebody they don't want to hug, taking turns during play, or refraining from stimming, they get something they want, like playtime with a favorite toy, or a snack, or a high five, or a break from therapy. I've heard these tactics being compared to dog training. However, one autistic dog trainer said that he would never compare the two because he would never treat his dog like that. So let's get down to the nitty-gritty. What does ABA therapy really tell an autistic child? A quick Google search will turn up thousands of comments from actual autistic people about the ABA process that they say gave them the loud and clear message that their natural way of being was wrong and that they are flawed, they're disordered, dysfunctional, and disturbing to the neurotypical people. They say ABA tells them that they must give in to the will of others over their own in order to be accepted and be given the things that they need. People who've been through ABA say that their decisions are not theirs to make, that their body is not theirs to use or control, and that their future is subject to what others think that they're capable of, not self-efficacy, which is a person's own belief about what they're capable of. Now, there are studies that suggest ABA is effective in modifying a child's behavior. It's true. But what's really important here? What really matters? Yeah, you can get somebody to behave a certain way. Yippee! But does that come at a cost? Yes, it does. Is behavior change more important than the child's psychological well-being or sense of safety or sense of belonging and acceptance? Essentially, isn't the child being praised for masking and punished for being authentic? In fact, one study found nearly 50% of those who participated in ABA therapy suffered from PTSD because of it. It pushes compliance over anything else, and it can really crush their spirit. Another problem is that the recommended time in ABA therapy is over 20 hours per week for many years. That's like 4 to 8 hours a day of uncomfortable, sometimes terrorizing, traumatizing time with an ABA therapist that the creator, Dr. Lavas, said the child should be afraid of. So how is that not going to traumatize a child? And heaven help a child who gets a therapist who doesn't really care and just pretends in front of the parents. If so many autistic individuals who've actually been through ABA therapy say it's so harmful and damaging, and there's very weak evidence as to its efficacy, why are we still doing ABA therapy in the United States? Because neurotypical people think it works. They see on the outside an autistic child who's behaving more like a neurotypical child. But that would be a neurotypical person assuming that they know how an autistic child feels or thinks. Let me just reiterate that idea. A neurotypical person cannot assume that they know how a neurodivergent person feels or thinks. They can assume it, but they're not going to be right. A mental health professional once told me that a certain autistic person who was having a meltdown was doing it for attention, and that he figured out how to play us and his parents for that attention. It makes no sense to punish someone for having a meltdown that they largely can't control. Meltdowns are a form of communication, and it's one that people can't ignore because obviously some signs of something got missed somewhere along the way, and it led to a meltdown. And there are so many factors that contribute to a meltdown. Maybe there are sensory issues going on, and maybe a neurotypical person doesn't sense that. Or that it's not that bad to the neurotypical person. They don't feel like it's that bad. But that doesn't mean the autistic person feels the same way. And by demeaning them or demanding that they behave like a neurotypical person, we're telling them that their pain isn't valid and that their feelings and experiences should be suppressed. So Now you've got also organizations that are just in love with their little puzzle piece logo styles and are wealthy from donations and government funding because they can hire the best marketers and the grant writers and the rubbing elbows with the elites, convincing Hollywood A-listers that they are the authority on all things autism, even though actual autistic people all over the world can't stand these organizations. We get unfortunate depictions in movies like Music by the singer-songwriter and now movie producer Sia as a result. So many autistic people don't like that the very origin of these organizations' goals sought to cure autism as if it were a terrible disease. And these organizations do support the use of ABA therapy largely, among 100 other reasons. Again, do a Google search and you'll find that the vast majority of actual autistic adults on there have a sincere disdain and a hatred for these organizations who just love their little puzzle pieces because they don't seem to get it. And keep doing things that further hurt autistic people and are spreading the wrong ideas about autism in their opinion. One study of 2,000 autistic people found that 93% of them reject ABA therapy. So is nobody at the state or federal level listening to the people that actually this affects most? Like, autism is not a deficiency or a disgrace. It's a difference, and that's great. Okay. So if you've decided ABA and other compliance-based interventions are not right for you or anyone, not even for my cute little puppy Luna, then what can you do to help someone who is autistic and needs greater support? I would like to address this real quick. My heart is truly mindful of the hundreds of thousands of individuals who need a lot of support and their families and professionals who offer that support, such as families with a teen who might be able to injure a parent or sibling during meltdowns, or those with severe communication challenges, or families that feel like they have no other choice but to deadbolt their child in the rooms for the safety of everybody involved. My heart truly goes out to you. I've heard parents say that this is where ABA and medication appear to be best and the only option for them. Again, I'm mindful of you, and I'm thankful that there are alternatives to ABA. Many of them do require a lot of work on the caregiver's part to find something that works for the child, but you're already doing a lot of work. Remember, there are as many different presentations of autism as there are autistic people. So the first step I'm going to offer is huge, and this is the number one. Assess the environment. This is big because the environment can mean so many different things, from the temperature of the room to the thoughts in the head. It's all environmental in some way. So, yeah, is your child feeling safe and comfortable in the places they go or in their environment? Meaning, are they being bullied, abused, or anything else that's causing upset within their mind? Guess what? ABA can be one of those upsetting things. Watch my video on stimming for information on what stimming is trying to tell us. The big thing, if your child's telling you something that's bothering them, you've got to listen to it and take it seriously. And I know most of you are. It could be as simple as not getting a pizza party at school because the whole class didn't reach a goal. Well, that's a bunch of crap. Most kids can shrug that off, but that might have been a really big deal to an autistic kid that really was looking forward to that nasty old rubbery 2-inch wide slice of cold pizza with that torn off piece of paper towel and a cup of water. The kids look forward to that kind of stuff, those pizza parties. Teachers are all hyping up that pizza party all year. Is their environment changing where they're feeling lost? A change in staff at school? Did a pet die? Has the routine changed? Has their teacher removed recess privileges due to misbehavior? By the way, this one really upsets me. I have written so many letters to schools on behalf of clients stating that taking away a child's recess when they're diagnosed with ADHD and autism is counterproductive. Recess is a right, not a privilege, in my opinion. Number 2, if ABA is all about trying to get a child to do something they say no to, maybe it's time to allow them to say no. Obviously, that can be taken advantage of real quick, but let your child know that they have the right to say no and have it actually mean something. Likewise, all of their communication should be taken seriously. It has to be frustrating to feel like you have no voice, or that nobody cares what you say, or that your opinions don't matter. Number 3, would they benefit from a speech therapist or occupational therapist instead of an ABA provider to meet some of their needs? Someone who's highly trained and has lots of experience and doesn't like ABA-style therapies are easier to find than you might think. So consider some of these alternative forms of therapy. Maybe some of you are already doing them. Maybe give it another shot and explain where you're coming from. Number 4, when is the last time a full physical, food assessment, and blood panel was done? Is there a history of thyroid issues in the family? That can wreak havoc on mental health and functioning. Are they low on vitamin levels? Is diabetes a factor? Are there sensitivities to certain foods or allergies? These things can all have a huge effect on a person's mental state. Medications, medications, medications. That's our fifth point, medications. If your child's having major issues and is on medications, get a second, third, and fourth opinion on their medication regimen. So, number 6. Speaking of body changes, puberty. Oh, puberty. Are there sexual things going on that you may or may not know about? Consult with a psychologist about how to best address puberty in a way that honors their phase of life, their body, and the natural way of being. Both boys and girls do this with. And I'll tell you right now, I'm not in favor of shaming someone for positive, developmentally appropriate sexually health attitudes and behaviors. So please consult a professional on this and try not to rely on people or organizations with strong opinions not based on scientific data. Number 7. Oftentimes, autistic loved ones have just as many or even more needs for privacy and leisure time than neurotypical people do. They need their own space and their own time, alone, away from the demands of the world. Let them recharge, and if school is too much, modify their schedule. If therapy is too much, modify the schedule. Honor their autism and their needs. Number 8, relieve yourself and them of expectations. Everyone walks a different path and at different paces. Some will stop and smell the flowers, others will zoom right through. Either way, it's okay. Let them be them at their own pace, with gentle instruction, with kindness, empathy, and with the idea that it'll all be okay. And it is okay now, too. I have 20-something-year-olds that I've worked with who are often discouraged that they're not in a place in their life where they want to be. Really, after analyzing their statements, they were not in life where their friends were at that age. So they were comparing themselves to other people. They feel guilt and shame for having their own timeline. Once they honored their timeline, their own life process, then it's okay to be 24, they find, and living at home, as long as that's a good environment. Or it's okay to marry, having only dated one person in your life. Or it's okay to wait for the right job that fits them come along. Or it's okay to take a job with the idea that it's just a learning experience or a stepping stone rather than the occupation they'll have the rest of their lives. When it comes to expectations based on societal norms, take it down a few notches. Number 9 is pathological demand avoidance, PDA, present. This is when an autistic person has high anxiety related to expectations placed on them, and the emotional turmoil is so extreme that they avoid those demands at all costs, or suffer a meltdown, or a shutdown, or other unpleasant results. I've spoken about honoring the autism, but really that means honoring the autistic individually. There are workarounds for nearly anything while meeting the needs of the family and honoring the autistic person. You have to be willing to do more compromising than you think might be fair. If school is a giant fight, there are alternatives. If getting ready for church always includes crying and stomach aches, look for alternatives. There's always a workaround for almost anything. Just don't listen to the people who say, well, that's just life and they have to get used to it. No, it's not. Just no, okay? Number 11, spend quality one-on-one time with your autistic child in a way that's positive and promotes personal growth. Everyone wants to feel special. Allow it. I know you're a parent and a caregiver and you're overwhelmed and probably underappreciated, but this helps all the way around. You don't have to do anything amazing. Maybe just sit and watch anime with your teen if they're into that. By the way, a lot of autistic teens I find are into anime because it can do a good job of taking complex emotions and social situations and exaggerates them into scenes that they can make sense of and kind of identify with. Not all of them, but this is what I found to be a trend. Or true amongst a lot of them. Anyway, maybe go on a walk or a hike with them. Work on a motorbike together. Watch YouTube together. Do something together. Just spend quality time one-on-one with them. Number 12, get some sleep and relax. Nobody does well when there's not enough sleep. Every moment with your kids is limited to being the only one, and you can't get those moments months or years back. Get the sleep you need because you're no good to anyone or anything without adequate sleep. Number 13, if you're a fan of some ABA techniques, know that there are things ABA therapists do that are good that are not ABA, but might get clumped together with it. Sometimes they're totally different types of therapies, like floor-time therapy, for instance. It's a good example of this. It's not ABA, but some ABA therapists use floor-time therapy. Floor-time therapy is all about building relationships with the autistic child by getting down on the floor with them and playing and interacting and taking turns. This isn't about behavior only, but it's about the child and the relationship and feeling trust. But the best option is treating autistic children like respected human beings with voices that are heard. I hope this video helps you in your neurodiverse universe. I'm Dr. Service, and I thank you for watching, and please like, share, and subscribe. We'll see you next time.